week's video, I want to talk to you about scheduling and what do you do or how do you handle a patient if maybe your schedule's booked out, I don't know, a week, months, 2 months, it doesn't matter. What do you do whenever a patient wants to schedule their appointment like right away, but you don't have anything for several months? So how do you overcome that? How do you make the patient feel taken care of, but also create a lot of positive authority in your practice? So let's use this example. So let's say a patient calls in, they're a new patient and they want to come in and they want to see you for, let's just call it a hygiene visit. We'll keep it easy, okay? So patient calls and the next hygiene appointment that you have happens to be 2, maybe even 3 months out. And there's only so much you can handle personally. And so you're saying, gosh, Lauren, how do I make this patient feel taken care of? But I don't have anything for 2 or 3 months. How do we overcome that? So there's a lot of wonderful things that you can do. First of all, if you're booked 2 or 3 months in advance, like congratulations on being a very busy office. That's awesome. We might need to have a capacity conversation and say, okay, can we continue to expand or offer some additional times for patients, or can we look to add additional operatories in our office? So that's outside of the scope of today. But what can you do whenever you're a busy office and you don't have anything for several months? Well, we've talked previously about authority and building authority for your doctor or your practice if you have multiple doctors. This is an amazing time to do that. So let's say you have the Susie patient on the phone and the next time that you can see them is in 2.5 months, okay? So make sure that you're building authority for your practice or your doctor during the conversation. So you might say something like, our practice has been in the area for over 15 years. And, I don't know if you know, but we were actually voted one of the best practices for our county within the last couple of years. So every single person that comes into our practice is personally trained by our we'll call her Dr. Johnson. So Dr. Johnson's hand-selected every single member of our team, but also has helped personally train all of our clinical team. So I want to let you know, Susie patient, that you are going to have just an amazing experience in our practice. Now, it does look like the first available that we have for a hygiene visit is 2 months from today. So here's what we're going to go ahead and do. I'm going to go ahead and get you scheduled as quickly as possible. But in the meantime, if there's an opening or something becomes available sooner, I'm going to put you on our quick fill or ASAP list, and we will absolutely give you a call. I know that your time's valuable, and I know you're really wanting to try to come in and see Dr. Smith soon, but we are a busy office, and so we do book our patients out in advance. So let's go ahead and get you scheduled. Now, let's break this down, shall we? There's a few things that I want to point out from this conversation. One, I built authority for the doctor, the owning doctor in the practice along the way. Part of the conversation was continuously building authority. We were voted best in the area. We've been in the area for 15 years. Dr. Johnson hand trained our team. So make sure that you're creating authority for either the business owner, the doctor who owns the practice, and or the entire practice. So you want to make sure that patient feels like, wow, I get to see this practice. Like, this is amazing. And then you're giving the patient a solution. Here's what we're going to do is a powerful phrase. Tell the patient what you're going to do. Here's what we're going to do. Let's go ahead and get you scheduled. So you're assuming the sale, as they say in the sales word, you're assuming the close. So you're assuming that they are, of course, going to book with you, but you're also providing them a solution, which is if something becomes available, we will absolutely give you a call. You can even say, if you're the scheduler, if you personally are the one who handles the schedule, say either myself or one of our team members will personally reach out to you and get you scheduled sooner, and then go ahead and move forward. So remind me, Mrs. Jones or Susie patient, would you prefer a morning or an afternoon? Once you address it, once you have the conversation, it's so easy to continue the conversation and to guide your patient to the appointment. What the patient wants most importantly are solutions. Be a solution-focused practice, be a solution-focused team member, and you will always provide your patients with an exceptional experience and get more yeses than nos.